My name is John Buse. I'm a professor of medicine in the Division of Endocrinology, and I specialize in the treatment of diabetes. I only see patients with diabetes, both type 1 and type 2 diabetes. I care for a few people with prediabetes and some with only obesity. My approach to care in helping people with diabetes manage their disease is what we call shared decision making. Basically, making sure that people are well informed about their condition, about the options for treatment, and selecting the right path for them. And then over time, trying to modify that path. No one can do this perfectly. And so it's a matter of having people feel good about how they're managing their disease and optimistic about their future. My academic interest is in developing new treatments for the prevention of diabetes, for the treatment of diabetes, and for the management of the complications of diabetes. I think today people with diabetes can live out a normal lifespan, but it's really based on a lot of the innovations that have been pioneered here at UNC. We were actually the first site in the country to use GLP-1 receptor agonists, these most popular drugs for managing diabetes and obesity. We were the first site to actually administer them to people with diabetes. The most rewarding part of my job is working with colleagues. We have an amazing team, diabetes educators, pharmacists, residents, fellows, students. It's really inspiring to see how committed and how brilliant these young people are. It's just been a pleasure to work with them for the last 30 years. You know, I work a lot of hours. I spend time at the coast. We have a house in Maryhill, a little hamlet outside of Edenton, and I love watching the waves and hearing the birds, and one day hope to do a little bit more farming out there. When I was 17 years old, me and my best friend spent a weekend at a beach house, and late in the evening, we both woke up, and to make a long story short, we saw an apparition, a 2.5 foot tall Native American woman walking across the foot of my bed. Never figured out what that was, but it certainly has kept me open to possibilities about spirituality and the importance of the context of the lives we live.